Hi, I'm Nandini, physiotherapist from Aster RV Hospital. Now I'm going to discuss about the physiotherapy intervention for the adult with liver disease, where they're going to end up in the surgery. We are going to discuss about the pre-operative stage and also the post-operative stage. First, the problem list, which is very foremost thing in the pre-operatively, it is the lack of awareness about the surgery and the importance of the physiotherapy among the population with the liver disease, also the attenders of them. Second is the poor pulmonary fitness and the musculoskeletal changes. It leads to reduce the aerobic capacity and it reduces the muscle strength and muscle endurance, and also reduces the flexibility and the balance of the adult population, and it ends up in reducing the activity of their daily life. These are the major problem lists that can be faced in the pre-operative stages. Whereas in the post-operatively, it is going to be the poor chest hygiene, and also they are going to end up in immobilization for first one day, and so that it should not be prolonged for them. Reduced activity participation and reduced aerobic capacity and out of bed mobility activities. These could be the problem activities, and also along with the increased excessive fatigueness can be seen post-operatively. Means of physiotherapy by this can help the transplant patients to come or overcome all these things. First means of physiotherapy to avoid the lack of awareness is to sit and explain to the patient and the patient attender about the things and how it can be sorted out. It will be done along with the consultant, and also importance of physiotherapy will be explained properly, and we'll set the goals pre-operatively to achieve certain goals for them, so that post-operatively they don't end up in complications like immobilization and reduced quality of the muscles or less activity of daily lives. So we train them pre-operatively. Pre-operatively, as like we have discussed, the pulmonary training has to be done, like giving them incentive spirometer and ask them to do every 2 hours in a day, to avoid, especially immediately after taking food, to be avoided the spirometer. The lot of spirometer has to be done. Along with that, the breathing exercise technique, it has to divided into two phases, inspiratory and the expiratory phases, where inspiratory phases it can be helpful with the incentive spirometer and straw sucking, whereas the expiratory phases is going to be the paper blow, bubble blowing, whistle blowing and balloon blowing. These all can helpful for the pulmonary training exercises. And with the muscle strengthening exercises, the first and basic thing that can be helpful is free exercises can be taught for the liver disease patients. So to prevent the excessive deformity or contracture, and also helps in free joint range of motions. All these can be helpful. Along with the little weight training will be trained along with the light weighted therapies and the free weights in the pre-operative sessions, along with the proper medications and the review with the physiotherapy. Post-operatively, it is going to be the same like intensive care unit physiotherapy, where followed by inpatient rehabilitation. First and foremost is going to be to prevent the immobilization. The adult have to be mobilized on the first day or the second day, seeing or monitoring the vitals, and the other aspects should not be interfered. The physiotherapy can be started on the day 1. After the extubation, after certain hours of the extubation, where we follow them, give them a chest physiotherapy and basic limb activities, monitoring the vitals. Followed by the next session or the next day, we ask them to do the high sitting, at least standing and sitting on the chair, with the effective pulmonary training exercises. Followed by in the later few days, we start them with the effective free exercises to prevent immobilization also, and to improve the activity of them and to be very brisk. We first initially start with the free exercises of both upper limb and the lower limb, concentrating on major muscles of the upper limb and the lower limb, followed by the ambulation, that is making the patient walking around inside the ICU. After that, step down ICU or the inward patient, we ask them to start with the free weights with the light therabands, including all the mentioned above exercises as to be carried out with the inpatient rehabilitation also. The first and foremost of all these things along with this is to follow the do's and the don'ts. They should not overreact with like pushing or pulling the heavy objectives initial stages, and the incision care is very important. We have to allow for the wound healing and graft stabilization by also concentrating on increasing the aerobic activity, increasing the muscle strength and the muscle endurance, and also including them to engage themselves on activities of daily life, and very sooner they have to be come out of the anxiety of the ICU psychosis, and they should feel that they are fit after the surgery. That is very important as a physiotherapist. And also I will discuss now about the exercise program with the demonstrations in the following videos.